We will discuss today how to use a glucometer and the best practices for accurate glucose monitoring. There are two basic types of glucose meters, the standard and the continuous glucose monitors, which are newer on the market. We will be discussing the standard intermittent glucose monitor in this presentation and how to use it. The continuous glucose monitors, they're a little different. They use a tiny sensor placed under the skin, and they transmit a readout on your blood glucose to a special monitoring device or even a smartphone, and it's an ongoing, continuous every 5 to 15 minutes. This technology is great as it reduces the need for frequent finger sticks, but it's still important to know how to take standard glucose measurements. Blood sugar testing requires the use of a special machine called a glucometer. This machine measures the amount of sugar in a very small amount of blood, usually taken from the fingertip, and it's placed on a disposable test strip. You should always follow the instructions that come with your meter, as there are many different types of glucometers on the market. We need to know why we're testing for blood glucose. Fingerstick testing for blood sugar or glucose. It's an important tool in managing diabetes and preventing the serious complications that can be caused. It can also monitor the effect of the diabetes medications on blood sugar levels to see how effective they are. It will identify blood sugar levels that maybe are too high or too low and need to be corrected. It's an overall process where we can track the patient's general treatment goals to see that they're staying in compliance. And it also shows us how various factors such as illness, stress, diet, and even exercise can affect different blood sugar levels. I will review some general instructions for glucometer use, and these may not be accurate for all types of models. For example, while the fingers are the most common sites to use, some glucometers do allow the use of a thigh, a forearm, or even the fleshy part of the hand. You should always check the manual for your specific device as to the appropriate site for your glucometer. If for any reason you are unsure of the instructions for the device you are using or they are unavailable, you can always search online for that device name, and an operating manual is usually available. The first step in obtaining a blood sugar reading or a glucose reading is to gather your supplies. Before you use the glucometer, make sure you have them all ready and handy. You should have an alcohol prep pad and an optional 2x2 gauze for blotting the blood at the end of the test. A pair of gloves if you're working with a patient. It is not necessary to use gloves when you're testing your own blood. A lancing device with a fresh lancet inserted. This is what is used to draw the blood drop. A test strip, and the most important thing about the test strip is to always check the expiration date before using it. And you should always have a way of recording the results, as keeping a log is very important for all healthcare providers. It is very important to remember that you use the correct test strips specially made to work with your glucometer. The lancets need to be the right design for whatever lancing device you are using. And again, this is all explained in the operations manual for your specific device. Being properly prepared will help determine the most accurate glucose result. This process can be done quickly, but doing it right will help you avoid having to re-stick again. First, wash your hands and apply non-sterile gloves if you are working with a patient's blood. Explain the patient what the procedure will be. Wash the patient's hands or the site that you're going to be used with warm water to improve the blood flow to that area. If the facility policy, use the alcohol swab to clean the site. Any skin contaminants will alter the blood glucose results. Keep the area that you will be puncturing in a dependent position below the level of the waist Do not milk or massage the finger site because this can introduce excess tissue fluid and hemolyze the specimen. To obtain a test sample, turn on the glucometer, and this is usually done by inserting a test strip. Do not touch the test pad portion of the reagent strip. Alternatively, some glucometers require you to place the strip on a clean, dry surface, for example, a paper towel, with the test pad facing up. This step is totally dependent on the type of glucometer you are using. It is important to immediately reseal the test strip container once you have taken one out, because you will then avoid any accidental contamination of the remaining strips. The glucometer will tell you when it's time to put blood on the strip. Use the lance device to pierce the side of the finger next to the fingernail or whatever recommended location for your specific glucometer. Using the side of the finger hurts less than lancing the pads of the fingers. The middle or ring finger is actually preferred as it has the greatest depth of tissue beneath the skin. The thumb or first finger, index finger, is more likely to be calloused or scarred, as well as being more sensitive. Therefore, it would make the procedure more painful. Gently squeeze above the site to produce a large droplet of blood sufficient to cover the test pad on the reagent strip. Continue to place the drop of blood on the strip until the glucometer indicates there is enough. Use the first or even the second drop of blood as per policy or your manufacturer's instructions. The test pad must absorb the droplet. Smearing the blood will alter the test results. Just allow it to be absorbed. Once it indicates there is sufficient blood, blot the finger with the alcohol prep pad or the gauze to stop the bleeding. Wait a few minutes for the glucometer to generate a reading. Dispose of the lancets in a hazardous waste sharps container and document the results per the facility policy. The American Diabetes Association generally recommends the following target blood sugar levels. Before meals, ideally they should be between 80 and 130 milligrams per deciliter, or 4.4 to 7.2 millimoles per liter. When it is 2 hours after a meal, the blood glucose should ideally be less than 180 milligrams per deciliter, or 10 millimoles per liter. The ADA does note, though, that these goals often depend on different ages and health status. For instance, some people will have a slightly higher blood sugar goal, including people who are older than 60, may have other medical conditions with their heart, lung, kidney, whatever, or have a reduced ability to sense low blood sugar levels, called hypoglycemia unawareness. Always check with the healthcare provider for the proper blood sugar goals for each individual person. To avoid some common problems, if you do get a result that does not fit with previous levels or is not consistent with how the patient feels, take a second test to be sure you have an accurate reading. For example, if the blood glucose says it is very low, but they have no symptoms, it is always best to recheck. Anytime the results are out of range, a second check can be done to confirm its accuracy. If the result continues to be persistently out of range, it is best to report it to your healthcare provider. Other key points to avoid common problems would be: don't use expired test strips. Always check the expiration date before you take one out. They can give inaccurate blood glucose results. Store these strips in their container with the lid tightly closed. Any high temperature, any light, moisture can cause damage to these strips. Inaccurate cleansing of the skin can cause incorrect readings. Any food contaminant or any contaminant at all on the skin where you are lancing can cause an inaccurate blood glucose reading. Clean your device at regular intervals. Always run the quality control checks when prompted. Your manual or your facility policy will tell you how often this calibration is required. Some devices require larger blood samples, and always be sure to use the blood sample size required by your device. So in review, the few key points that you need to remember about using a glucometer include: you should always follow the instructions that come with your specific type of glucometer. Always calibrate that meter as required by facility policy or manufacturer's instructions. Check the expiration dates on the test strips every time. Be sure to clean the site on the skin prior and allow it to dry fully. Use gravity or warm water prior to lancing and then massage to obtain a sufficient size drop of blood. Dispose of the sharps, the lancets, in a hazardous waste sharps container, and repeat any unusual or abnormal readings and report them to the healthcare provider if they persistently stay out of range. Thank you for your time.